Good afternoon, good people.
Good afternoon.
Well, my name is Abdul Tambadu. It's a joy to host this talk show with Sister Uray. And our today guest is Mame Awa Sene, doctorate student in the medicine department at Senegal University. Currently residents at the regional hospital at Chess.
Right. Thank you.
Welcome.
Thank you for having me.
Anytime. So can you tell us a little bit about yourself?
Yes, my name is Mame Awa Sene. As you stated earlier, I'm a doctorate student at the University of Jean in the medicine department, and currently I'm a resident at the regional hospital at Chess in internal medicine.
Excellent. That's good then. Yes, Sister Uray?
Yeah, Mr. Tambadu, thank you for. Good afternoon, dear followers from Facebook, and good afternoon, dear listeners from the 89.3 station. So, I'm really elated to be here. I'm grateful, and welcome to your weekly show, the Baobabs Talk show. I really want to first of all give a warm welcome to our guest of honor, Dr. Mame Awa Sene. Hope you are super well. You're doing good, and thanks for being around. Just first of all, let me really just wanna give a slight objective of this weekly show. So, you know that the first objective of this show is to really be close to the population, as the Baobab FM is a radio for the community. It's the voice of the community. So just let me remind you that the first objective of this show is to be close to the population, because Baobab FM is stand for the voice of the community. It's a radio for the community, so that's why we always are willing to address topical issues, really, which so as to inform, but also educate the population. That's the first aim of this this show. And the other thing is also helping the English learners to really enhance the level of English and perform well. So I'm going to tell you that this show will be dedicated to COVID-19 in Senegal. And I'm going to just introduce it, because COVID-19 outbreak in Senegal is part of the worldwide pandemic of coronavirus disease 2019. The virus was confirmed to have reached Senegal on March 2, 2020. Despite the restriction adopted by the government, the Senegalese government especially, including the semi-lockdown measure, the state of emergency, and the curfew measures, the number of virus-related patients has risen markedly. So the fear of the people around the world relies on the fact that the virus is spreading daily on the daily basis, and at the same time the fact that it's sustained. So the sustainability of the virus, that's the main fear of these Senegalese people. And the government is at the same time seeking to save lives, but also shield the most vulnerable people from getting incomes losses, really. So he adapt some fast-track measures to really weather the crisis. So I'm gonna just give you back the floor, so that you're gonna jump right into the next step. Thank you.
Thank you, Sister Uray. Thank you for the good introduction of Baobab 89.2 FM Dakar, and thank you as well for the introduction of today's topic, which is about the COVID-19.
Yeah.
It's a very good introduction. Thank you for that. So,
You're welcome.
Guest Mame Awa Sene.
Yes.
I think the first question will be, what does COVID-19 means exactly? So, we see that many people are talking about coronavirus, COVID-19, but it seems many people don't really understand and know what the meaning of COVID-19.
Yeah.
I mean, what are the dangerosity of COVID-19. So if you are given the floor to explain us what does mean COVID-19 exactly, what will you tell us?
All right. Good afternoon again. Thank you to this wonderful host. I'm really glad to be here, and thank you for having me. So let's jump right into the topic. So let's start with the basics.
Yeah.
So what is a coronavirus? Coronaviruses are a large family of viruses which may cause illness in humans and animals. In humans, several coronaviruses are known to cause respiratory infections, ranging from the common cold to more severe disease like the Middle East Respiratory Syndrome, MERS, and the severe acute respiratory syndrome.
Yeah.
Both of these diseases are due to different types of coronaviruses in the past. For example, the MERS started in Saudi Arabia in 2012, and the SARS started in China in 2002. Now, the most recently discovered coronavirus is the coronavirus that causes the COVID-19 disease. So basically, COVID-19 is the infectious disease caused by this novel coronavirus. So COVID-19 just means coronavirus disease, and 19 because this outbreak first started in December 2019 in Wuhan, China. That's why it's called COVID-19. And COVID-19 only means that it is the infectious disease that is caused by this novel coronavirus. And the coronaviruses are not new to us. We already had outbreaks in the past, such as the MERS and the SARS. And now we're having a new outbreak and a new virus, and it is this COVID-19 pandemic right now.
Okay, thank you. So I think the next question gonna be the symptoms. What are the different symptoms and signs of COVID-19?
Well, the most common symptoms of the COVID-19 are fever, dry cough, and tiredness. Those are the most common symptoms. Other symptoms that are less common may still can be found in other patients, such as sore throat, conjunctivitis, nasal congestion, aches and pains of all types, loss of smell and taste, a rash on the skin, discoloration of fingers or toes. All the symptoms are usually mild and begin gradually. Now, according to the WHO, most people, around 80%, that are infected with COVID-19 heal without needing any hospital treatment. Now, around 1 out of every 5 people who are infected with COVID-19 will become seriously ill and develop serious illness. And we found that usually in older peoples and those who have underlying medical issues such as high blood pressure, cancer, or diabetes. Those people are at high risk of developing serious illness and having more severe symptoms such as shortness of breath, difficulty of breathing, chest pain or pressure, loss of movement or speech or coordination. But anyone can catch COVID-19 and become seriously ill, people of all ages. In any cases, when you have those symptoms, you should immediately seek medical attention.
Good. So, how does COVID-19 spread exactly?
So, COVID-19 transmission primarily occurs through direct, indirect, or close contact with infected people through saliva or respiratory secretions, or through respiratory droplets, which are expelled when an infected people speak, sing, cough, or sneeze. Now, the droplets are relatively heavy. They don't travel far, and they quickly sink to the ground. But we have to respect the barrier measures to avoid being infected. Now, the droplets that are expelled when an infected people cough or sneeze can land on surfaces or objects such as tables, doorknobs, handrails. And if someone touches those infected surfaces and then touches their nose or mouth or eyes, they can become infected. And some studies have shown that the COVID-19 virus can last up to 72 hours on stainless steel and plastic, less than 4 hours on copper, and less than 24 hours on cardboard. So it is really important to wash our hands at all times and really clean all types of surfaces that we use in our on a daily basis. Yes. Also, there are studies that are being conducted about airborne transmission, because it is definitely possible, because in some medical settings, airborne transmission is possible because there are medical procedures that are being done that can generate what we call aerosols. And in those type of medical settings, airborne transmission can occur. Either way, the WHO is still assessing ongoing research about all the ways COVID-19 can be transmitted. So, yeah.
It seems like they didn't master the virus yet. So, before moving to the next question, let me remind to our dear listeners and dear followers from Facebook that we are broadcasting here in EGICOM, which is a School of Journalism and Communication located in City Kalgorgi. So, which is good to know. The next question gonna be: Can we catch COVID-19 from infected surfaces or package from infected areas? I think you slightly talk about it. Just I want you to go deeper, really.
Yes.
Because there's a lot of talks about COVID-19. A lot of talk, and people don't really sometimes understand.
Yes, definitely. We can catch the virus from infected surfaces or objects. Like I said it earlier, if someone who is infected with COVID-19 sneeze or cough or talk or even sing, he can expel droplets that will land on the surfaces. Now, if those surfaces are not cleaned, the virus may remain on the surfaces for a certain amount of time. Like I said, the virus can survive up to 72 hours on stainless steel and plastic, less than 4 hours on copper, and less than 24 hours on cardboard. So if infected people sneeze and expel droplets on those surfaces, people can become infected if they touch those same surfaces and then touch their faces, like touch their nose, their mouths.
Yeah.
Exactly. They can become infected that way. So we can definitely get infected with COVID-19 by touching surfaces or objects that are infected.
Yeah.
Yes.
Good. Dear listeners, just to remind you, our today's guest is Mame Awa Sene, a doctorate student in the medicine department at the University of Senegal and currently a resident at Regional Hospital at Chess. So, Mame Awa, the next question will be, what can we do to protect ourselves and prevent the spread out of disease?
So really, the barrier measures are really simple. We have to regularly and thoroughly wash our hands with clean water and soap, or use a alcoholic-based hand rub if we don't have water and soap. It'll help kill the virus that is in our hands. Secondly, we have to practice good respiratory hygiene. It means always, if we have to sneeze on our bent elbow. If we have to cough, use a tissue that we'll dispose in the trash, and then wash our hands, and really try to stay at least 1 meter away from other people to avoid infecting other people. Also, avoid going to crowded places, because when you are in crowded places, it will be harder to maintain the 1 meter physical distance.
Yeah.
Firstly, and secondly, usually in crowded places, and especially if it's indoors, there's really poor ventilation.
Yeah.
So if there are infected people, just when they talk or sing, they will expel droplets that contain the virus, and since there's not a good ventilation, the virus will stay in the air. Just like I said earlier, there is a possibility of airborne transmission.
Okay.
Therefore, there is a higher risk of getting infected. So really try to avoid crowded places and going into indoor spaces with a lot of people. Also, it is really important to keep being informed on the latest information with trusted sources, just like the WHO and local health authorities, because every information we get about this COVID-19 changes by the day.
Yeah.
What we are talking about today may change tomorrow.
Yeah.
Everything that I've said today is really actualized, but to this date. It means that tomorrow this information may change, because every day there are multiple publications. There's an average of 500, but it can go up to 1,000 publications about coronaviruses that are being reviewed by the WHO.
Yeah.
And every day they are really giving us new information about this COVID-19 virus. So it's really important to stay informed and to follow the rules and regulations, about
Good.
the COVID-19.
But Mame Awa, what you say is very true. But with the Tabaski that is coming at the moment, do you really think that it will be possible for the Senegalese people to respect the social distance? Mainly women who go into the market preparing the Tabaski. Do you think once they are there, it will be easy for them to really respect those things?
It will be really complicated, because even
maybe if you have some suggestion about that things, because we've seen that many people go into the market and they never wear the masks, they never respect the social distance, and we are afraid at the moment what will happen after the Tabaski day.
Yes, I mean, at the very beginning of this outbreak, there was this fear of this virus that was here. People were really concerned about it, but we have noticed, and not only in Senegal, that there have been a blatant slackening of the rules and regulations. People are not wearing masks anymore. They're not respecting physical distancing anymore. So, and having this feast coming will only increase that. I think that people will only keep doing their their daily activities. And we just have to sensitize even more about this coronaviruses, tell them that this virus is real, it's here, it's killing people, and really insist on them respecting the barrier measures. I think that's the best we can do, because at some point there's only so much we can do. There's a part that is really individual. Like we cannot, force someone to wear a mask. We cannot force someone to physical distance. All we can do is really talk to them and sensitize them about the COVID-19 virus. So I think we, as this feast is happening very soon, we should really maybe improve our ways of communications with the population, and really try to sensitize them more to respect the barrier measures. Because if we don't, we are not out of the woods yet. If we look at the numbers everywhere, really it's going higher and higher. It's rising, and with this feast coming, it might even be bigger. So we really have to be more careful than ever.
Of course. And as you said, Mr. Tambadou, the Senegalese people, they ease those restrictions. They no longer wear masks. Even my way to the radio, I noticed that, really.
I did too.
So in my corner, I see some some young people always gathering in front of their houses, and just drinking the tea.
Absolutely, and even when you wear a mask now, they look at you in a weird way because you are wearing a mask, and they don't.
Really?
And maybe it's all the way around.
Okay.
It's all the way around. Like they should be wearing masks.
Yeah.
And if you're not, maybe people will look at you in a certain way. But now, if you wear a mask, people will look at you like, "Hey, what are you doing? What are you wearing?"
Yeah.
So it's
But they should know that they're no longer protecting themselves. They protect, or their whole families from this virus.
Yeah.
Really. Because for me, wearing this mask is a citizen act.
It is.
It relies on
it
is.
every Senegalese responsibility to wear.
It is.
So the next question is gonna be, how do you assess the current situation in Senegal, particularly the health sector, the health situation, healthcare system, and what are the challenges we are facing actually in the health sector in general?
So, as from now, compared to the beginning of this outbreak, we may say that things were a little bit under control because I remember our first case, we stayed maybe for a really long time before having another one. It was really going up very slowly. So maybe we thought we had things under control and we were really trying to contain this outbreak. But what we see now is that we have reached our full capacity of in our hospitals because we have serious cases that need special medical attention, and we don't have enough beds for those kind of patients. Therefore, it even brought us to change the way we deal with this virus. Because at the beginning was saying that if you are infected or if you have symptoms or if you think you have symptoms, you should call the numbers that were given and seek medical attention. And now even if you are diagnosed with COVID-19, and if you are asymptomatic, if you don't show any symptoms, they tell you to stay in your home and self-isolate. So that shows that we have reached our full capacity when it comes to dealing with this virus, because we can no longer take people in hospitals to give them the health treatment. And it was only a matter of time because even high power or countries that are most powerful than us, more and more developed, are facing the same issues. And it was just a matter of time before we found ourselves in the same situation. And when it comes to our healthcare system in general, this outbreak has only shown our weaknesses when it comes to the facilities, the materials. Everything. We lack, we lack of everything in the hospitals.
Yeah.
Even the mere products that we are using, we don't have it at the hospital. We always have to prescribe and give the patients so that they can go and buy it. And often, most of the times, they don't have the means for that. So it's really hard. And the thing is, this COVID-19 outbreak has really taken a huge place in this narrative, because people are even forgetting that there are other people that are sick with other diseases that are much more severe, much more dangerous than COVID-19, and people tend to forget them. But they are here, they are sick, and they also need medical attention. So maybe it's a collateral damage, but we are definitely experiencing it in our daily practice, because the government is giving all the means they can to treat patients that have COVID-19. But we should not forget that there are other patients too who need medical attention, that have serious disease, that needs drugs, and even the drugs that we're using for the COVID-19 disease, sometimes we don't have enough, and it's really complicated to really know how to handle both of them. Yes. So mainly that's the challenges we have been facing. during this pandemic, and also trying to keep our daily medicine activities and jungle it with the COVID-19. It's not easy as well, because we lack of the materials, but also the doctors. There are not enough doctors. Yes, exactly. So the human resources and the material resources are lacking in both sides. So we just try to deal with what we have and do our best with it.
Okay, to go with our own means.
Exactly.
Yeah.
Exactly.
Okay, good. But do you think it's enough the way the government is raising awareness? Do you think it's enough for the Senegalese population to really know what's going on exactly? Because we've seen that many people, it's still now, it seems they don't believe in COVID-19, because the way we're acting is a fact. The way we're acting is like it doesn't exist. And also, we all know also, since COVID-19 comes up to now, whenever someone passed away, they just say that it's due to COVID-19. And we all know that before COVID-19, thousands of people were passing away.
Yes.
And after the COVID-19, it will be the same things. So why nowadays, whatever happened in this world, they just say it's due to COVID-19? But do you think that, the population also, that things can make them to believe that COVID-19 exists?
Honestly, I don't think any amount of sensitizing will convince some people that the COVID-19 is real, because we have our own realities as a Senegalese people, being an African. We have our mentalities, we have our realities.
Yeah.
And I strongly believe that there are people who, no matter what you do, they will not believe in this COVID-19 pandemic.
Okay.
Because maybe it's our society that is like that. I don't know, but the facts are here. You cannot just come and say that this thing is not real, or just because you don't want to believe it. But it is definitely real. It's here. It's killing people, and the government is doing a good job in sensitizing people. Maybe we could do more, but I think that we just have to accept the fact that there will be people who will believe in it, and there will be people who will not believe in it.
Yeah.
And we just have to accept it and deal with it. But the fact is that when you don't believe in something, you will not adhere to it, which means that someone who does not believe in COVID-19 will not wear a mask, or will not respect the barrier measures at all, because he does not believe in the first place that this thing exists. So that is a challenge. That is a challenge for us to help them respect the rules and regulations.
Okay.
But do you think that this thing is pertaining to the fact that the government eased the measures, the basic restrictions, while the cases were, really increasing day by day? And it just say that you're gonna live with the virus by easing those restrictions.
Yes.
No longer the lockdown measures, no longer the state of emergency.
Yes.
While the cases keep rising.
Easing the COVID-19 restrictions while the cases were increasing. Definitely maybe encourage people to think that maybe this was not real at all.
That's so.
Exactly.
Yeah.
But I think that eventually we would have to ease the restrictions, because even as a human being, you cannot quarantine people forever. There is only so much we can go through. At some point, we would have to really try to live with the virus and maybe create a new normal, because the world as we know it has changed forever. And it is certain that things will not be back to the way it was before this pandemic. And we have to accept it, and we have to try to find ways to live with the virus. And I think that's what the government was trying to do. Maybe not in the right way, not in the right time, but I think eventually that's where we're going. Really, even if the confirmed cases were getting higher and the death toll were going higher, we would have to go back to our daily activities and just try to live with the viruses. Maybe the way that it has been done was not the best way, but yes, I think our hands were tied. So yes.
Good. So the negative and the positive impact COVID-19 is having the local and the global economy. Yeah.
Yes. So definitely we have noticed that there have been this COVID-19 pandemic has bring to a near standstill the local and global economy, because with the restrictions keeping people inside, the quarantine and everything, there are people who live day by day, who have to work every single day to get their subsistence, that could not do it anymore due to the curfew. So definitely it was a shock in the economic activities, and I think it's unprecedented. But I think maybe the positive impact would be being quarantined. It helped some people being really creative, and it helped them maybe develop their own businesses. Maybe really things that they were putting away and saying, I'll do it later and everything. Staying at home for such a long time helped them really focus on what they wanted to do, be creative and creating their own business. And that thing for me, that is the positive impact on the COVID-19 when it comes to the global economy. But I think the negative impact is more important, because as we have seen it, the unemployment rate has grown higher. Maybe not much here, but elsewhere we have seen that it has really grown higher. And it really impacted on many families here in Senegal.
I think it's time for break. Yeah. So we'll be back soon.
Yeah, we'll be back soon.
And I'm here to share with you my experience with the coronavirus, also known as COVID-19. It is a respiratory illness, which means it affects your lungs and is spread when droplets from the mouth or nose fly through the air. It can also be spread through contact, because the virus can survive a short period of time on some surfaces. So a person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching his face or nose right after. Some of the signs and symptoms of this illness are dry cough, high temperature, shortness of breath, diarrhea, loss of taste or smell, and muscle weakness. Unfortunately, they haven't found a cure for this illness yet, or a vaccine, so the best way to avoid it is by prevention. Washing your hands often with water and soap, or using hand sanitizer. Staying at home as much as possible unless you need to go out for essential needs, and if you do go out, wear a mask. You should also maintain a 6 feet distance from people and avoid crowded places. The way we've been trying to prevent this illness from spreading in our clinic is by screening all patients as well as staff members as soon as they come into the clinic. We check out temperatures and check for signs and symptoms. If anyone is showing a high temperature or has symptoms, that person is to be isolated immediately. We do this because we're dealing with a high-risk population, people with kidney failure. Other people that are high risk are the elderly people, HIV victims, cancer patients, asthmatic patients, because they all have a weaker immune system. So if you fall in any of these categories, the best thing to do is stay home and avoid crowds. A small tip of advice I'd like to add is to increase your intake on vitamin C to boost your immunity, drinking hot drinks like tea with lemon and ginger, and also adding garlic to your diet. It's a very good antioxidant. Thank you very much.
Vous écoutez Baobab FM 89.2.
Welcome back to Baobab Talk Show, 89.2 FM Dakar. So, thank you, good listeners. We just remind you our today's guest is Mame Awa Sene, a doctorate student at the Senegal University.
Hello, good afternoon again.
Good afternoon, Mame Awa.
So, Mame Awa, do you think that the practitioners here of the traditional medicine, because most of the time they're saying that they can cure the virus, but it seems like anybody can pay heed of what they were saying. What do you think really about this traditional medicine in Senegal?
Well, traditional medicine in Senegal is really a huge part of our healthcare system, because many people usually go to them first when they have any kind of symptoms before coming to the hospitals, because that's just the mentality is here. And we know that the COVID-19 is a type of flu, maybe just a really contagious and more dangerous flu, but it is a type of flu. And we know that there are really some medicinal plants that we use here that can cure. And if you have a cold or a flu, you can just take it and be done with it. So maybe those traditional practitioners may think that they can heal the coronavirus, or there is something they can do about it. Maybe there is, and we haven't discovered yet. But what we know is that there are not a specific treatment that can cure the COVID-19. We know that. All we do is really give symptomatic treatments, which means that we only treat the symptoms, but there are not a specific treatment that will heal the COVID-19. And we know that there are people who are infected that will heal without needing any hospital treatment, that will heal just by themselves, not taking anything. So I think that traditional medicine has its part to play in here, but definitely in a maybe scientific way, we know that there's not a specific treatment for this coronavirus.
But according to you, do you think that our Senegalese doctors will be ready really to collaborate with them, to work with
the traditional
doctors? Traditional practitioners?
Why not? We could be. It would have to be done really in clear terms. Really, it will be discussed and really well organized if we can collaborate and try to find ways. I don't think it have already been done here, but it's definitely a possibility.
I hope so. Yes.
Let us hope so.
Let's hope so. Because they always claiming, the doctors always claiming for the dosage of this traditional medicine. But I think if they work together, maybe the problem of the dosage will be.
They will find a solution.
Will be fixed.
They will find a solution. But the thing is, they also do some type of harms. Maybe sometimes more harm than good. Because of the mixtures they give to people, give them to drink. We receive patients in really, really bad shape after they went through with those traditional practitioners. So there have definitely there have to be some type of regulations,
of course,
of their practice, because sometimes they do really, really harm, and we receive patients really in bad shapes, and we have to just clean the mess, some sort, kind of.
Maybe it's because of some of them, they are not qualified to do those kind of things.
Definitely, and sometimes I don't know if it's ego, or they claim that they can heal some type of stuff. But really, they do more harm than good.
Really?
Yes.
So that's why then most of the doctors they don't
actually
trust them.
That's why because we see the damages firsthand. We see it because when we have a patient, we always ask him, did you go to a traditional practitioner before coming here? And most of the time the answer is yes. And they were given some types of drinks, and then we see the damages that is being done in the body. And I mean, it really saddened us to see that because it could be prevented.
Yeah.
And we just have to deal with the results. So that's why maybe some doctors are not really willing to collaborate with them.
Yeah. See, talking about the treatment, so what are the treatment options for COVID-19, including drugs, vaccines, and therapies?
So when it comes to drugs, to date, there are not a specific treatment for the COVID-19. There have been clinical trials and studies, ongoing researches that are being made to find really a specific treatment with COVID-19, but we haven't found it yet. There are some drugs that are being used, however, to treat COVID-19, like hydroxychloroquine. Maybe you heard of it. It helps, and some studies have shown that people are being cured from the COVID-19, but there are not really datas and peer-reviewed studies that have shown that this specific type of drug heals COVID-19. But that's what we do. We use the hydroxychloroquine and some antibiotics, and we use it as a treatment for the COVID-19 patients. And we have seen that some of them are getting better. But as we know it, some people get infected and recover from COVID-19 without having any kind of treatment. So there's not really hard data that are telling us that there is a specific treatment for COVID-19. And when it comes to vaccines, also really a lot of researches are being conducted in order to find a vaccine for the COVID-19. But to date, they have not found it yet. Some people are saying that maybe this year, later this year in December. Some people are saying mid 2021 maybe, but nothing really reliable yet.
That is sure yet.
We don't know for sure yet.
But Mame Awa, this COVID-19 is very stressful. Even doctors, we can see that even doctors themselves, they are very stressful with these things.
Yes, it is because of the things we see at the hospital.
Okay.
Yes. Sometimes you are in the hospital, you're dealing with COVID-19 patients. Sometimes you can see patients dying from COVID-19, and then you go outside and you hear people debating the very existence of this COVID-19.
Yeah.
I mean, it just blows our mind.
Okay.
Because, I mean, people are dying from this. We are seeing it firsthand, and people out there are
staying there talking about things that doesn't make sense.
If it's real or not.
Oh no, yeah.
So it really it's a factor of stress, definitely.
Yeah.
And of course, when we know that really is spreading, we don't fear for our lives, but mostly for our loved one, our families, because we are in close contact with infected people. So definitely, it's a factor of stress.
Okay, but how do you cope with stress during the COVID-19? Is there any advice or suggestion? Do you have doctors that you can give it to the population? Because we know that the stress that we have is enough, and COVID-19 comes with another stress.
Definitely.
So now things become very complicated for all of us.
Yes, it is.
Even children now, they know about the
I think it's really important to keep being informed, because some people say ignorance is bliss, but when you know, maybe it'll help you decrease the fear, because we only fear what we don't know. But if you get informed, if you know what is COVID-19, if you really seek informations, if you learn to know the virus is, how it is, and how to prevent it, the symptoms and everything, it'll help you really deal with this COVID-19 pandemic. And also, it's really important to try to keep our daily activities, of course, respecting the barrier measures, and really try to get back to our life as much as possible. Not like it was, because clearly it's not possible, but really try to do it with the barrier measures. and keeping in touch with our loved ones online or on the phone, exercising. Really, it'll help decrease the amount of stress.
Yeah.
Yes.
Good.
Getting enough sleep, working, really keeping our daily routine will really help us not maybe think too much about the COVID-19 and cope with it.
Yeah. Just to remind you, as Sister Ulei said, we are broadcasting from Ejicom School of Journalism and Communication, which located Cité Gorgui, and 89.2 FM Dakar. Ulei, do you have other questions?
I heard you mentioning the vaccine.
Yes.
And it will lead right to the next question about the vaccine, because many more scientists today are working on more than 150 vaccines and are hopeful to have a vaccine by December. Where most Senegalese people, they are reluctant to get vaccinated, even in general. Generally speaking, the African one. I don't know if you heard about those videos, on WhatsApp. They just trying to say that, the European people have not to use Africa as a lab, as a test lab. So, what do you think really of that matter?
Well, I think it's fair game. It's fair game.
Really?
Yes, because if you think about it, if there's a vaccine that is being made in Europe, why would they want to test it here in Africa? They can go and test it in their own country.
Yeah.
Why, if you want to test a vaccine, test it in your own people. It is true, we are not a lab test. If we have our own scientists working on vaccines, they can come here. I think people will be more comfortable, will be more willing to get tested or to get vaccinated. But if there are some types of vaccine that are being made in Europe, and then they want to test it here in Africa, I think there's reason really to be reluctant about it. If they want to test the vaccines, I think they should test it. They should test it with their own people, and if they have real results, then we will consider using those vaccines. And if we have scientists here in Africa or in our own country, I think then people will be more willing to be vaccinated. And obviously it is hard to think that they would just come and vaccinate us for free. People would think maybe there's something behind, and they will get concerned. And I think it's fair game. So it's just too easy to come here as a savior and bring the drug or the vaccines. We have to test it first, and not on us. Test it, give us results, give us hard data, studies, and that shows that these vaccines are safe. And maybe we will consider get vaccinated. But apart from that, it is true that here in Africa, people are really reluctant to get vaccinated, even if before this COVID-19 pandemic. And I think maybe it's our societies that is just like that. We have some type of mentalities, and people are not really comfortable with the idea of getting vaccinated. And I think it's a profound problem that is underlying here way before this COVID-19 pandemic.
Yeah. Is there anything that we should not do, we African people?
Regarding this?
Yes, regarding this situation.
I think, yes, everything that is opposite to respecting the barrier measures, we should not be doing it. Such as really being too much in close contact with people, being in crowded places, indoor places with many peoples. It'll only help spreading the virus. And really, there are a lot of things that we should not do, and those are just a few examples among them. Yeah.
But do you think you doctors, you are ready for, after the Tabaski? It's going to be a very hard situation. From what I have seen in the city at the moment, the way people interacting with one another. with no social distance.
Yes,
no
wearing masks.
Yes.
To be honest, sometimes I look at the people and look at myself.
Yes.
I say, okay, they are not in a security, but myself, I am not too.
Of course.
You see?
Definitely.
Because those who going to the market are those who from the house, and those who are from the house are those who are staying in the house.
Of course.
Absolutely.
Yeah.
You know, it's like a domino effect.
Yes.
Even if there's one, it only takes one people to really break the chains of transmissions, and it only takes one people to infect so many others.
Yeah.
So even if you respect the barrier measures, if there's one people who is not, I won't say that it's pointless, but it will really decrease the chances of stopping this pandemic. And to the questions, if we are ready for what's coming after this phase, I don't know, because as of now we are facing so many challenges. It's really hard already. So after the feast, if the confirmed cases are rising and we're having more and more sick people in the hospital, things might become really out of hands, and
Yeah, it might get worse.
yes, it might get worse, definitely.
Yeah.
Really. So before tackling the weekly roundup, I am gonna ask you really the type of tips, preventive tips you're gonna deliver today for the Senegalese people. You know, to better really weather this crisis, because right now we have, you know, sick and tired of you know, really of this virus. So but we have to really just respect those measures. And so you're a doctor and you really eyewitness this kind of cases. So what gonna be your preventive tips?
What I would say is that really insist on the fact that this COVID-19 pandemic is real. I mean, it's very real. It's here. People are getting infected. People are actually dying from it. So it's really, really, really important to respect the barrier measures. It may be hard in the beginning, and it may be hard to tell ourselves and to think that our lives has changed for forever. But we have to face it. We have to accept it, that things will be different from now on, and we have to live that way. And it's really respecting those simple measures: social distancing, self-isolating if we have any types of symptoms, wearing masks, protecting ourselves, but also protecting our families and loved ones. I think it's the best way really to diminish the spread of this virus and really stop this pandemic.
Okay, good. So as doctors, I mean, how do you find the way the Ministry of Healthcare managing this situation, the way they're managing things? How do you find it in general? You doctors, are there something that they're missing? Are they doing everything that you need, you doctors at the hospitals?
I don't know, you want to get me in trouble with our ministry?
No, not getting you into trouble.
I'm just teasing.
Yeah.
Yes, definitely. I think they're doing their best really to deal with this virus.
Yeah.
But there's a lot of things that needs to be done at the moment, because like I said it earlier, we're facing many challenges. We do not have enough equipment in the hospitals to deal with all the cases, not even the coronavirus, but for all other patients that have other disease. So I think there's definitely more to be done in this area, and it's only about a political will to do it, because I mean the money is here. Every day we hear millions and billions are being distributed here and there. Yes, so the money is here, so it should only be directed in the right way and in the right facilities, and that is the healthcare system. Yes,
of course, really. So I think it's time to deal with the weekly roundup. Concerning the local news, despite the end of the state of emergency in Senegal, some leisure remain closed indefinitely due to the social distancing measures. Few days before the Tabaski festival in Senegal, the veterinarians warn people about respecting their social distancing with sheep, because if they are in contact with an infected people, they can be contaminated and transmitted the virus. According to the international news, California tops 400,000 cases, close to surpassing New York. US near 4 million cases with 141,000 plus deaths. European Union agrees on landmark economy recovery plan. The European Union leaders strike historic $2 trillion deal to rebuild the European economy. Really interesting.
Yeah, really interesting.
So Russia interference in United Kingdom. The British House of Representatives asked for invitation. So these are the news, that we got during the week.
Yeah, thank you for that.
Yeah. So I think it's time to sum up.
Yes.
Yeah, we're almost at the end of the radio broadcast.
Yeah.
So I'm gonna just give you the floor. So
Thank you so much, Sister Urey.
But I will come back maybe.
Yeah, sure. Yeah. Maybe the last question will be just Mame Awa. What will be your last word, and what will you suggest the Senegalese people, mainly the youth?
I would just say that, especially to youth, that they are the future of this country. They have to show the way, and they have to be role models for the younger generations.
Yeah.
So they have to lead the way. It means they have to be the first to respect the barrier measures. They have to show the way. They have to wear masks and social distance. And we see that they are the part of the population that are most exposed to the danger of this pandemic. So I really urge them to respect the rules and regulation about this COVID-19. And to the population in general, just insist on the fact that this virus is very, very, very real. People are getting infected. People are dying from it. They have to help us help them.
Good.
Really respecting the barrier measures will not only protect them, but they will also protect us, because the more confirmed cases we have, the more exposed we are as essential workers, and it'll only be harder on us and our families. So really, it's a teamwork, but also there is a individual responsibilities for each and everyone, and everyone should really just stick to the measures and respect the rules and regulations.
Definitely.
Yeah.
Yes.
Thank you so much,
Thank you.
Mame Awa Sene. It's
Thank
an
you.
honor to have you here.
Thank you for having me too.
Yeah,
It was a pleasure.
any time. As it has been said, everything that is clear in
Of
mind
course.
is well expressed and easily understood.
Of course.
Definitely.
And thank you for answering all the questions in a very correct way, with the pragmatism and the
Of course,
professionalism.
really.
We really appreciate it.
Really.
So thank you so much.
Thank you for
And
hosting
we are,
me.
we are looking forward
Yeah.
to see you very soon.
Very
Very
soon,
soon,
indeed.
So
inshallah.
it's just an honor and
Yeah.
a pleasure also
We're
to
here.
host this talk show today. And it is Abdul Tambaru and Sister Urey
Yeah.
Fall who was hosting this talk show, and we are happy to be here.
Yeah.
Thank you so much, and see you this coming Saturdays,
Yeah,
inshallah.
yeah.
So,
Yeah, of
Sister
course.
Urey,
Just I want to thank you first for being around and making this show possible and really enjoyable.
Thank
You
you.
really deserve more consideration and respect, not
Yeah.
only as women but also
Yeah.
as doctor.
Yes.
yeah, that's true.
Of
Yeah,
course, really. But thank you, dear listeners and dear followers from Facebook.
Facebook.
We are always delighted to be here around the Baobab Talk Show, and we're gonna just thank the staff, because Baobab Talk Show is a staff,
yeah,
and all the people behind. They are using all available means to make things happen. Thanks for all you are doing and your handless support. and also my own team, really. So I just want to thank you all, from United States, even from Senegal. They always standing by me, just really pushing me forward. Thank you. Thanks a lot for really helping me, for your support and
then we need to thank Senegal.
Of course, really. And
Senegal,
of course, really. Senegal, really, you should have been here. So with us. But no more.
Maybe next time, inshallah.
Next time, inshallah. God willing. Thanks for.
Good.
Vous écoutez Baobabs FM 89.2.